Fibrodysplasia ossificans progressiva, FOP, also known as stone man disease, or formerly myositis ossificans progressiva, is an exceptionally rare connective tissue disorder that transforms fibrous connective tissue, such as muscles, tendons, and ligaments, into bone tissue. It stands as the only known medical condition where one organ system metamorphoses into another. It affects approximately 1 in 2 million people worldwide. FOP is caused by a mutation in the ACVR1 gene. This genetic alteration disrupts the body's repair mechanism, leading to the ossification of fibrous tissues. These tissues, including muscle, tendons, and ligaments, become bone, either spontaneously or due to trauma. Even minor injuries can trigger permanent joint fusion as new bone forms, replacing damaged muscle tissue. This process, known as heterotopic ossification, eventually creates a secondary skeleton, progressively limiting the patient's mobility. Remarkably, this newly formed bone is identical to normal bone, albeit in improper locations. Children born with FOP often exhibit malformed big toes, sometimes missing a joint, or presenting a noticeable lump at the minor joint. The first flare-up leading to FOP bone formation typically occurs before the age of 10. Bone growth generally progresses from the top of the body downward, mirroring fetal bone development. Additional bones emerge sequentially, starting at the neck and extending to the feet. Ossification typically begins in dorsal, axial, cranial, and proximal regions, followed by progression to ventral, appendicular, caudal, and distal regions. Unfortunately, there is no cure or specific treatment for FOP. Surgical removal of extra bone growth paradoxically triggers additional bone formation in the affected area. Despite varying rates of bone growth, FOP ultimately leaves patients immobilized as new bone replaces musculature and fuses with the existing skeleton. The median life expectancy for FOP patients, if properly managed, is around 40 years old.